Gestational diabetes is a type of diabetes that develops during pregnancy. It is a condition that requires careful management to ensure the health of both the mother and the baby. It affects how your body uses sugar or glucose. Normally, your body breaks down the food you eat into glucose, which then enters your bloodstream. Glucose is important because it gives your baby energy to grow. Your baby relies on this energy to develop properly throughout the pregnancy. If you have gestational diabetes, your body can't make enough insulin or use it effectively. Insulin is a hormone produced by the pancreas that helps your body use glucose for energy. Insulin is a hormone that helps your body use glucose for energy. Without enough insulin, glucose builds up in your blood instead of being used by your cells. When your body doesn't have enough insulin or can't use it properly, too much glucose stays in your blood. This condition is known as hyperglycemia or high blood sugar. This is called high blood sugar. High blood sugar can lead to various complications if not managed properly. High blood sugar can cause problems for you and your baby during pregnancy and delivery. These problems can include preterm birth, excessive birth weight, and an increased risk of cesarean delivery. The good news is that gestational diabetes is manageable. With proper care and monitoring, you can keep your blood sugar levels within a healthy range. With the right care, you can have a healthy pregnancy and a healthy baby. This includes following a balanced diet, getting regular exercise, and monitoring your blood sugar levels. This guide will help you understand gestational diabetes and how it's treated. It will provide you with the information you need to make informed decisions about your health. It will also provide tips for managing the condition and staying healthy. By following these tips, you can reduce the risks associated with gestational diabetes and ensure a positive outcome for you and your baby. Early detection and treatment of gestational diabetes are crucial for the well-being of both mother and baby. This condition, if left undiagnosed and untreated, can lead to serious health issues for both parties involved. By identifying the condition early on, healthcare providers can work with expectant mothers to implement necessary lifestyle changes and medical interventions. These changes might include a balanced diet, regular physical activity, and sometimes medication to manage blood sugar levels effectively. Early diagnosis allows for timely management of blood sugar levels, minimizing the risk of complications. Regular monitoring and adjustments can help maintain optimal health for both mother and baby throughout the pregnancy. These complications can include high birth weight, premature birth, and other delivery-related issues. High birth weight can lead to difficulties during labor and delivery, increasing the likelihood of a cesarean section. Additionally, low blood sugar in the baby after delivery can pose immediate health risks, requiring prompt medical attention to stabilize the newborn's condition. For the mother, untreated gestational diabetes can increase the risk of developing type 2 diabetes later in life. This long-term risk underscores the importance of managing the condition effectively during pregnancy. Routine screening for gestational diabetes is typically done between 24 and 28 weeks of pregnancy. This screening involves a glucose tolerance test, which helps in identifying any abnormalities in blood sugar levels. Early detection empowers expectant mothers to take control of their health and make informed decisions throughout their pregnancy journey. With the right support and guidance, they can navigate this period with confidence, ensuring the best possible outcomes for themselves and their babies. Regular checkups, adherence to medical advice, and a proactive approach to health can make a significant difference in managing gestational diabetes effectively. The first step in treating gestational diabetes is often making healthy lifestyle changes. These changes focus on two key areas: diet and exercise. A balanced diet is essential for managing your blood sugar levels. Your healthcare provider or a registered dietitian can help you create a meal plan that meets your individual needs. They will teach you about portion control and choosing foods that are low in sugar and high in fiber. Regular physical activity is also important. It helps your body use insulin more effectively. Aim for at least 30 minutes of moderate intensity exercise most days of the week. A healthy diet plays a crucial role in managing gestational diabetes and ensuring a healthy pregnancy. By making mindful food choices, you can help control your blood sugar levels and support the well-being of both you and your baby. Your diet should provide all the nutrients you and your growing baby need while helping you maintain healthy blood sugar levels. This means incorporating a variety of foods that are rich in essential vitamins and minerals. Focus on consuming plenty of fruits, vegetables, and whole grains, These foods are not only packed with nutrients, but also provide the fiber necessary to keep your digestive system healthy and your blood sugar levels stable. These foods are rich in fiber, which helps regulate blood sugar levels. Fiber slows down the absorption of sugar into your bloodstream, preventing spikes and crashes that can be harmful during pregnancy. Choose lean protein sources such as chicken, fish, beans, and lentils. These proteins are essential for the growth and development of your baby and can help you feel full and satisfied without raising your blood sugar levels. Limit your intake of sugary drinks, processed foods, and saturated and unhealthy fats. These items can cause rapid increases in blood sugar and contribute to weight gain, which can complicate gestational diabetes management. Working with a registered dietitian specializing in gestational diabetes can provide personalized guidance and support. They can help you navigate food choices, portion sizes, and meal timing to optimize your blood sugar control. They can help you create a meal plan tailored to your specific needs and preferences. This personalized approach ensures that you are getting the right balance of nutrients while keeping your blood sugar levels in check, making your pregnancy journey healthier and more enjoyable. Section 5. Exercise. Staying active for a healthy pregnancy. Regular exercise offers numerous benefits during pregnancy, especially for women managing gestational diabetes. It helps improve insulin sensitivity, which means your body can use insulin more effectively to regulate blood sugar levels. Engage in at least 30 minutes of moderate intensity exercise most days of the week. Choose activities you enjoy and that are safe during pregnancy, such as brisk walking, swimming, or prenatal yoga. Listen to your body and avoid overexertion. Stay hydrated by drinking plenty of water before, during, and after your workouts. If you have any concerns about exercising during pregnancy, consult your healthcare provider. Section 6. Monitoring your blood sugar levels. Monitoring your blood sugar levels is a crucial aspect of managing gestational diabetes. It helps you track how your body responds to food, exercise, and any medications you may be taking. Your healthcare provider will instruct you on how to check your blood sugar levels using a blood glucose meter. They will also let you know how often to check your levels, which may vary depending on your individual needs. Keep a record of your blood sugar readings to share with your healthcare provider. This information helps them adjust your treatment plan as needed. Section 7. Medication. When lifestyle changes aren't enough. While lifestyle changes are the cornerstone of gestational diabetes management, some women may require medication to control their blood sugar levels effectively. If lifestyle changes alone are not sufficient, your healthcare provider may prescribe insulin injections or oral medications. Insulin helps lower blood sugar levels by allowing glucose to enter your cells. Oral medications work in different ways to improve insulin production or sensitivity. The type and dosage of medication will be individualized based on your specific needs and how your blood sugar levels respond. It's important to follow your healthcare provider's instructions carefully and take your medication as prescribed. Section 8. Postpartum care and long-term health. After you give birth, gestational diabetes usually goes away. However, it's essential to continue monitoring your health because having gestational diabetes increases your risk of developing type 2 diabetes later in life. Your healthcare provider will likely recommend a blood sugar test 6 to 12 weeks after delivery to assess your risk. They may also recommend ongoing monitoring and lifestyle modifications to reduce your risk of developing type 2 diabetes. Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity are essential for long-term health. Section 9. A collaborative approach to care. Managing gestational diabetes effectively requires a collaborative approach involving you and your healthcare team. Your healthcare team will provide guidance, support, and monitoring throughout your pregnancy journey. They will work with you to develop an individualized treatment plan and make adjustments as needed. Don't hesitate to ask questions, express any concerns, and actively participate in your care. By working together, you can have a healthy pregnancy and a healthy baby.